Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. I have my favorite pharmacist here with me again today. Joining me is Dr. Michaela Wachal, who is a doctor of pharmacy with a Bachelor of Science in Biochemistry and is a certified specialty pharmacist. She holds 17 active state pharmacist licenses and has spent 9 years working in specialty pharmacy, including roles as Center of Excellence Pharmacist for Hemophilia, Endocrinology, Fertility, and Immunology. Pharmacist in charge, clinical pharmacist, and clinical accreditation manager. Motivated by her experience raising a child with autism, ADHD, and anxiety, Michaela began studying functional and integrative pediatric approaches after observing worsening symptoms of psychiatric medications. Working collaboratively with his physician's team, she helped to transition him off of multiple medications while implementing targeted nutritional supports, gut-focused interventions, and detoxification strategies that resulted in significant improvements. Michaela is currently pursuing advanced training in functional pediatric psychology and using her platform to educate families on emerging research involving neuroinflammation, toxic exposure, nutrient-brain interactions, metabolic contributors to pediatric behavioral health so parents can make informed decisions grounded in both evidence and individualized risk awareness. Welcome back.
Thank you. I'm so glad to be here.
So I connected with Dr. Wachal on Instagram because I've always had this question. I'm kind of like, why are more pharmacists not speaking out about things like the bioavailability of aluminum and the amount of aluminum in vaccines and things like that? And that's actually how I came across Dr. Wachal on Instagram, and she's also known as your functional pharmacist. That's where you can find her on social. And we did a show a while back, a few months ago, that I got such good feedback from our audience. And I was like, yes, I'll have her back on again because we talked about aluminum and we talked about aluminum adjuvants in vaccines. And it is just such great information to get out there. So I am just so incredibly grateful to you that you
Mhm.
are using your background and your education and, your platform to educate about these topics. And so I wanted to have you back to talk about some other things that I think are just so pertinent to our health today. So to our audience, some of the things we're going to talk about today are going to be another controversial topic of seed oils. We're going to talk about that and how the impacts of that on our health. And we're also going to talk about genetic variations. And then at the end, we did want to touch on aluminum again, which we're going to go over. We're going to touch on aluminum detoxification. So I would love to hear your feedback on, the seed oils and the fatty acid ratios. And one thing I wanted to mention, so I am seeing that nutritionists now, because I feel like people are not really watching mainstream media as much, but people are now going to social media for
Yeah.
information. And then we are seeing like large corporations fund dietitians to promote things like seed oils, like saying canola oil and soybean
Mhm.
oil, and all of these ultra processed oils are actually healthy for us. And I would love to hear your feedback.
Yes. Definitely a controversial topic. And I think that there's a lot of confusion around this because of what we were historically taught and no one questioning it, which oils are best to use and why, or which ones may not be beneficial to our health. So it is confusing when you still have organizations like American Heart Association, claiming that seed oils are heart healthy. Now, the seed oils I'm talking about are the canola, corn, cottonseed, rice, grapeseed, safflower, and sunflower, and soybean. And it's especially deceiving because when you hear these, you think, oh, they're from seeds like this is something healthy. But they are highly processed. And the key here is that they are prone to oxidation. So they create reactive oxygen species that drive oxidative stress and inflammation. And that oxidative stress is linked to almost every health condition, autoimmune diseases, cardiovascular, cancer, obesity, type 2 diabetes, autism, Alzheimer's, and even mental health, so anxiety, depression, OCD, or bipolar disorder. There's just more and more research coming out about how important it is to connect the supporting oxidative stress and the inflammatory components. So I stepped back and looked at the structures to try to figure out chemically, why are certain oils maybe not great for us. And when you look at the structures, so the seed oils are polyunsaturated fatty acids, or the PUFAs, with mostly linoleic acid. So this, like the soy, sunflower, safflower, and polyunsaturated fatty acids have lots of double bonds. So they are considered unstable because when oxygen gets to it, it creates free radicals, which causes degradation and drives the oxidative stress. And then when you use high temperatures and cooking, that accelerates the process. Okay. And then monounsaturated are also prone to oxidation, but less than polyunsaturated fats because it has less double bonds. So this is like your olive oil, and that primarily has oleic acid. So it's much more stable in heat because it doesn't have all those double bonds that the PUFAs do. And then we have saturated fats. So those don't have any double bonds. And so they're highly stable and resistant towards oxidation. Things like coconut oil, your animal fats, and butter. Real butter, though, not margarine, because that's trans fat. And even when we say animal fats like lard or tallow, those are usually like a mix of saturated and monounsaturated fats. So it just gets confusing because it's not always straightforward on it's just polyunsaturated fat. They're usually a mix, and so that's why I think there's a lot of confusion on that too. But then I tend to look at which fatty acid is going to be least likely to drive oxidative stress, and that's the saturated fat. Okay, and then monounsaturated, then polyunsaturated, and of course, trans fats are top drivers. So those are the worst. Okay, so olive oil and avocado oil are predominantly monounsaturated. So they're around 75% monounsaturated with about 13 or 14% polyunsaturated and saturated. And so but then also how they're made makes a difference too. So like with olive oil, you have the extra virgin cold pressed oil. And that's better because it doesn't use like the heat or chemicals to extract it. So it keeps the polyphenols, which are the antioxidants, and that's what can also help LDL cholesterol from oxidizing. And so when we think of like atherosclerosis, it's the oxidized LDL that sticks to arteries. Okay, and then we also have unrefined or virgin avocado oil is very similar. And so those are the two I cook with. And then I try to avoid all other seed oils because I know they're prone to oxidation. And they don't also have those polyphenols as well. And then trans fats, of course, are the worst because they promote cardiovascular risk with LDL oxidation. And so think vegetable oil shortening. I don't know if that's still used, but it is that. Margarine, and what's typically, it's just think foods that are like fast food and processed food. And so I would say if this is completely new information to someone, or you're trying to like make those changes to transition into a healthier lifestyle, like decrease inflammation, the most impactful is going to be avoiding trans fats because they're strong drivers of oxidative stress and inflammation. And then I would, start making those changes of using, olive oil instead of vegetable oil, real butter instead of margarine, no fried foods, trade, fries in for a salad, your packaged bakery items, reading labels, and then you can start to decrease from polyunsaturated unsaturated fatty acids to monounsaturated fatty acids and saturated. So to me, it helps to think of it in terms of oxidation and inflammation, if that makes sense.
Yes. Oh, I love that. And one thing that I have always found is so remarkable because I do believe that God designed our bodies with that ability to heal. But when we are cooking essentially all of our foods or consuming processed packaged foods that were cooked in these highly processed seed oils, we are really destroying the quality of that food. And, when I for example, am working and I'm coaching somebody through an anti-inflammatory diet, and I'm working to get them on real foods and then get them cooking with things like cold pressed olive oil. It is absolutely amazing. Within 4 weeks, we start to see differences. And again, I convinced my very skeptical husband that like wanted to go to the grocery store and buy all he's in the same room with me, but he wanted to go to the grocery store and buy like the cheaper things. And now he is totally on board with, how we kind of budget for our family now. I mean,
Yeah.
we spend less money on, clothes or, for an example, like I don't go and get my nails done. I get my hair
Yeah.
cut like twice a year. But, we really
Yeah.
prioritize food and what goes into the body because we understand how important it is. And
Yep.
one thing that I have found very frustrating is there is such an uptick right now, and there's such a pushback against this. There's such an uptick on just confusing information that is going out to the public. And one thing that I that I saw, it was a PhD level nutritionist that was talking about canola oil and about how ultra processed canola oil, we just don't have the evidence that it's bad for you. And yes,
Mm.
of course they use chemicals and the processing, but after it's processed, those chemicals, they're all gone and it's totally safe to
Oh
use
God.
and it's cheap. And I remember just thinking, I was like, okay, my common sense brain tells me that if you just walk over to kitchen, you get your ultra processed canola oil out of the cabinet, and then you use the nose that God gave us to smell that canola oil. After you smell that canola oil, do you really want to cook all your food in there? We don't need to have like a PhD nutritionist that is like, there's just no evidence. Yeah, because and because seeds are healthy and whatnot. And again, it's very different if you are going and you are consuming raw sunflower seeds versus if you are cooking and frying your food and an ultra processed sunflower oil. And I'm also
Yep.
seeing a lot of companies that people are kind of thinking canola oil is bad. So now I'm seeing all of this sunflower and safflower oil. And with those types of oils, do you think that they are just as bad as the canola oil, or is it a little better on some spectrum?
Well, I'd have to look at, how much is polyunsaturated versus monounsaturated and saturated because usually they're all a combination. And I think even like sunflower oil, you can get different kinds where it has different amounts, and so some may be other better than others. But then it still comes down to, the ratio too. So they provide your omega 6 and your omega 3s, but not in the same way that we used to get them. So in our modern days, we're getting way more omega 6 compared to omega 3 because of the processed food. So before processed foods and industrialization, the humans would get, it was thought to be about 1 to 1 to 4 to 1 ratio of omega 6 to omega 3. But now it's around 20 to 1 because of seed oils. And because they're in everything, they're in our packaged foods and they're in our processed foods.
Say
And
that
so,
again. So now you
yeah.
said they're 20 to 1 now, and what were they before?
So it's thought before industrialization, like the processed foods, 1 to 1 to 4 to 1 ratio of omega 6 to omega 3s. But now it's so high in omega 6, it's around 20 to 1. Like just without
Ooh.
trying, with us, eating our modern diet, if you're eating processed food because you have all these seed oils in your processed foods, and I think it's what 60% of Americans' diets are like processed foods now. If you're not actually trying to avoid that. Uh, and so think about that change. And omega 6 to omega 3 then is that higher ratio is thought to be pro-inflammatory, which drives chronic inflammation.
And again, we know that over the vast majority of chronic diseases, over 70% of chronic diseases in our country are lifestyle and nutrition related. So there is so much that we can do
Mhm.
to prevent that. And then also, when in functional medicine, we know this. We know that when people are chronically inflamed, which we know that conditions such as mental illness, such as metabolic disorder, autoimmune conditions, immune system disorders, there is that inflammatory component,
Yeah.
and there is so much we can do to reduce inflammation. And when you mentioned about
Yeah.
mental illness, so I recently did a deep dive in this in my mentorship for my educational programs about neuroinflammation about and all the evidence showing that there are actually, when people are super inflamed, there are inflammatory cytokines that are
Mm.
produced within the body that can actually bypass the blood brain barrier. And when we reduce inflammation, we can see many of those symptoms start to dissipate.
Yeah.
And that is something too with, you helped to recover your son so much from these types of interventions. And I did want to circle
Yeah.
back around to that because I think that your story is so miraculous. And I wanted to ask about, can you tell our listeners about how much improvement he had when you worked with him through these, functional medicine modalities?
I mean, you wouldn't have any idea today. I mean, I guess 100%. I mean, well, not,
Oh,
we're not
wonderful.
going to say 100%, but 90%. Um, yeah, I mean, the struggles we have today are the struggles any family has, I guess, with raising boys or raising kids. Um, so it's just been crazy to witness that firsthand, um, to be where we were to now, and he's he's thriving. So it's been amazing and very eye opening, of course.
And you mentioned too that you were able to help him get off of the pharmaceuticals
Hmm.
and recover naturally. And I just know of so many families where their children are having behavioral issues or even neuropsychiatric issues, and the child continues on a very, very inflammatory diet, and not only are they on the inflammatory diet, but they also have excessive screen times. And
Yep.
then the pediatric psychiatrist, they really don't know they might talk about screens, but they're certainly not going to talk about your seed oil intake or your detoxification. So then these
Right.
children who are really suffering and have an increased toxic burden are then put on more and more medications, and it is
Yeah.
so incredibly heartbreaking. So, but
Yeah.
I love what you're doing, and I love to elevate your story and other stories like this
Mhm.
because, we need to get the word out to parents that
Yeah.
there is hope. And I also wanted to ask about genetics and where genetics come into play here. So,
Yeah.
do you think that people with certain genetic variations that, may impair things like detoxification are going to have a more difficult time when they are consuming things like highly processed foods and seed oils?
Yeah, I think that definitely plays a role. Of course, we all are unique and have different susceptibilities, but there's certainly different variants that, especially if they're additive, or if you have multiple SNPs, that may affect how things are eliminated. Then yes, you can definitely see where that comes into play. And so, like I said, all of us have these SNPs, which are single nucleotide polymorphisms, and these the more they can contribute to the susceptibility of certain conditions. So I think the best example or the most widely talked one that you may know of is MTHFR, because for a good reason, because of the impact on folate, methylation, and homocysteine, which are all critical in our cellular functioning. So individuals with MTHFR, I think it's C677T, if they have two CCs, which are two cytosines, that's normal functioning for that enzyme. And if there's one thymine in place of a cytosine, there's a 30 to 40% reduced activity. And then if there's two thymines instead of the cytosines, that's a 60 to 70% reduced activity. So if someone has a 60 to 70% reduced ability to get folate into the active form, which is 5-methyl tetrahydrofolate, to be used by the body, that's pretty significant. Almost every human cell depends on a functional folate cycle. and active folate to get into the cells. And then if you think of, the most rapidly dividing cells have highest folate demand. So if you think skin, gut lining, your red and white blood cell production, a neural tube development for fetal development, those are where you can see the fast improvement when the folate cycle is improved. As long as you have those other cofactors that are needed to make those as well. So like for red blood cells, if you need adequate iron, B12, B6, and protein. So if you have all those things on board and you improve your folate cycle, then you see improvement. But if you're deficient in any of those, then you may still, be anemic. But when we come to think of our modern diet and our ultra-processed food, like let's think someone with a DRD2 or DRD4 variant, they may be more likely to overeat certain foods and not turn them down because of that dopamine reward pathway. There's other variants in like FTO that can impact the signaling that you're full, and that's associated with obesity. And certain variants that increase the risk for type 2 diabetes because of greater spikes in blood sugars. You can have variants that make you more susceptible to inflammation and detoxification capacity. So you guys all may be familiar with the CYP enzymes in the liver. Those are what we have for phase 1 detox. And that's where a lot of the pharmacogenomics comes in, because if we know someone is a rapid metabolizer or a slow metabolizer, that can tell us how they're going to respond to a drug. So they may need like a lower or higher dose. That's going to apply to other things as well, not just drugs. And then there's also the neutralizing enzymes for your phase 2 and detox pathways. And these are going to be enzymes, or these are going to be enzymes like glutathione, S-transferase, the sulfation enzymes. You can also have variants in antioxidant enzymes that neutralize your free radicals, like superoxide dismutase or glutathione peroxidase. So that impacts the overall glutathione system. There's variants, you'd have variants in all the different pathways. So if you have one variant that's significant, that can still impact you, but then you may have variants in every pathway that, add up and have significant effects. And so you may react much stronger to toxins than others because you can't clear and neutralize them efficiently.
Yes, and that is also it's so interesting because you have individuals, like I have a family member, and she looks way younger than she actually is. She can eat whatever she wants, and that she's been smoking cigarettes for like, I don't know, 50 years, and somehow she looks 10 years younger than she really is. Then for me, if I am even around cigarette smoke, I feel like death. I cannot handle inflammatory foods, or I basically fall apart, but I can get my health under control if I am living a healthy lifestyle. I am just fine. But one of the genetic variations that I have is actually HLA-DR, and individuals with that genetic variation have a difficult time properly metabolizing and detoxifying from mycotoxins. And for our listeners, those are toxins produced from mold spores. So I was actually very, very, very ill in our home, and that is something moving forward. We know wherever we move, if we move again, we've got to make sure that we get a thorough inspection and that we are on top of like the humidity in the home and all of these extra things. But, and I also do think that when we talk about toxic exposure, not just mold, but also things like when we are injecting individuals with aluminum, which I know we both love to talk about, aluminum adjuvants being injected into babies. And it's just so asinine to me that we're all different. We're so different. And that people will say, well, my kid got those vaccines and my kid's just fine. And they gaslight other people, but our genetics are all different. So can you explain, say a child that has an MTHFR, there's like a dysregulated MTHFR genetic variant or maybe COMT or just other genetic
Yep.
variations that may impair detoxification. Can you explain how those individuals may then be at an increased risk for adverse reactions to vaccinations?
Yeah. Well, and actually, for the vaccines for infants, I do want to highlight that primary route of elimination for aluminum is through the kidneys. And so, with normal functioning going on, you're going to pee most of that out if it hasn't accumulated in any tissues. But what I want to highlight there is that normal kidney function is what is assumed when it comes to the amount of aluminum in vaccines, and they've included infants in that normal function. And we know infants do not fit in that category because their kidney function doesn't reach adulthood until 1 to 2 years of age. And then glomerular filtration rate that doubles in the first 2 weeks after birth. So then think how underdeveloped a preemie's kidney function is, yet we follow the same vaccine schedule when this is a critical area of concern with their kidney development. And that increases their susceptibility to effects from toxins, because if the kidneys get saturated, meaning there's more to filter than what they're able to do or what they're able to filter, if the aluminum isn't able to be eliminated, then that stays in the blood to be distributed where it can accumulate, in the tissues and bone and the brain. And so I just want to point that out, is that right there, the kidney function, we're assuming that infants have this normal kidney function and the same function as adults, and that's just not true. So
And
I want to highlight that.
another thing I want to mention too is the liver enzymes are also immature with infants, especially
Yeah.
cytochrome P450. So those are actually underdeveloped at birth. And then when we are giving vaccines on the first day of birth, and what I am really, and guys, I'm going to post the show that we did on aluminum. But one thing that I am extremely disappointed by is that there are so many medical professionals that do not understand or recognize that the rate of absorption, the bioavailability from injecting aluminum
Mhm.
into the muscle, which is a very vascular area, they're not recognizing the difference between that and then
Right.
ingested aluminum. And I know that when you inject it intramuscularly, the absorption rate is around 60 to 100%. Is that right?
Yep. Yep. And then oral ingestion is only about 0.1 to 0.3%. And so you have to orally intake significantly more aluminum to be the same amount that would get to your blood as a injection.
And then something I hear people say is they're like, well, if you don't think aluminum in vaccines is safe, then you don't think breast milk is safe because it's in breast milk too. And we have to think about it that aluminum is a naturally occurring element found in the Earth's crust. However, the naturally occurring element aluminum is bound to other things that inhibit the absorption, such as things like silica. But then when we take aluminum, the elemental aluminum, and then we change it to aluminum hydroxide, they essentially are stripping those other compounds that prevent that absorption. And one more thing before we go to break, something else I've heard people are like, that is aluminum salt. When they turn it, when they take aluminum and they change it to aluminum hydroxide. Oh, okay, I shouldn't be laughing about this, but it is so absurd. I can't keep a straight face. People say that when they take the aluminum and they transform it to aluminum hydroxide, somehow that is removing the heavy metal and it just turns into a salt.
Yeah, and it's like, no, that makes no sense. Mechanically, like the aluminum is still there.
Yeah, yeah, but I just there's so many absurd things, and this is like one of the hills I will die on is the injecting aluminum into the public when we do not have sufficient safety studies in this
Right.
area. It's so controversial, and there
Absolutely.
are I think there's a lot of pharmaceutical marketing, and they're basically telling providers what to say, but then what the providers are saying, it doesn't make any sense. So, but it's, you basically, they're having individuals with authority say things that are not correct, which if we just know a little bit about history, I mean, how many times has this happened that physicians were used to say things that are incorrect? Like when physicians
Absolutely.
used to recommend pregnant women smoke cigarettes. So anyway, it is about time for a break. Before we cut to break, I do want to remind our listeners, if you are a fed up nurse, I can absolutely train you at the Functional Nurse Academy. We offer the most comprehensive functional medicine training on the market, specifically designed for nurses. All of our graduates receive 90 nursing CEs, a social media and marketing kit, 6 months free of live business mentorship, and eligibility for multiple board certification titles. So be sure that you check that out at functionalnurseacademy.com. You can also join me at my next live informational webinar, which I will post in the show notes. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. Today I am joined by Dr. Michaela Wachal, who is also known as the functional pharmacist. And she has been using her platform to educate about functional psychiatry, functional pediatric psychiatry, after she helped to recover her son who was suffering with multiple health conditions. And today we're talking about just some really hot topics. The first part of the show, we talked about seed oils, and then we also talked about genetic variations. And here we are again talking about aluminum. And we also are going to start talking about the negative health impacts of aluminum in addition to aluminum detoxification. Welcome back, Dr. Wachal.
Hey, thank you so much.
Well, I feel like we could do this, like, I don't know, like 10-part series because there's just so much to talk about here. And I know before we went to break, we were just debunking some of these aluminum claims. And I also wanted to get your opinion. So I think that in, I don't know, 50 or 100 years from now, if Jesus hasn't come back by then, I think that people are going to look back at the fact that we were injecting infants with aluminum, and it's going to be comparable to how we look back now on things like lobotomies and putting mercury amalgams in people, because there's all these things that have gone on in history and in medicine and in dentistry that we look at that now and we're like, that's totally insane. I
Mhm.
think that I do think it's going to get so bad that they're going to end up having to take the aluminum out of the vaccines and other medical products. And then we're also going to look back at it like this insane time in history. Do you have an opinion on that? Do you think that we're going to make any progress as far as getting the
I
aluminum out?
do. I do. I think there's a lot of momentum right now, and I think what's going to be so tricky is with industry pushing back full force, because of course, if they took them out of vaccines, that's billions of dollars to reformulate all the vaccines. So of course, they absolutely don't want to do that. But even all of Dr. Chris Exley's work, I mean, he's been studying aluminum intensely. And so it's been his life mission for like 30 years. And, that's making it to more people that he has just, his research is, um, that's incredible. I mean, when you can show actually a high content of aluminum in human brains of deceased individuals with Alzheimer's, with multiple sclerosis, with autism. When you can show that, but that gets ignored, that just tells me there's major issues because it's being censored and suppressed. Because that should not be something that we're not looking into more. That there shouldn't be more studies on. That shouldn't be taken more seriously. That's those are major red flags. And then all the studies to follow. There's thousands of studies demonstrating the harm of aluminum. It is a known neurotoxin. There's no safe limit. There's no biological purpose in our bodies. So yes, I think eventually in time. I don't know when, hopefully sooner than later, that we'll look back and say, what were we doing?
Yes, yes. And I remember with my I have 3 beautiful children now. I've been blessed with 3 children, 2 that are babies. And, yes, over my dead body will anybody in my household receive, any vaccine right now because there are for me, there are too many red flags, especially the aluminum adjuvant. And I did fully vax my first child up to 18 months because I didn't know this information. However, even back then, when I was an ignorant, indoctrinated nurse in the system, I knew to at least not use deodorant with aluminum in it. I knew not to cook all my food in aluminum. And I really, honestly, genuinely did not know that there was aluminum in the vaccines. I had no idea about this. And I was administering vaccines at my job. So I was really this was like a really hard pill to swallow for me
Mhm.
because, I did something to my child that I can't remove the
Right.
aluminum from him. And then I also was administering these vaccines telling people that they were safe and effective. But I am hopeful that this information I think that you can't contain it, because there are so many of us out there talking about it. And by the way, for our listeners, that is one of my favorite studies to just show around. And again, why in the world, if we have a study like that where we're like, okay, this post-mortem study, we're seeing high levels of aluminum in the brain tissue of Alzheimer's and MS and autism. Oh, but it's not that aluminum is, not in there in the other samples of the postmortem studies of people that don't have those conditions. Why in the world would there not be more research
Yeah.
into that? That is a huge red flag, something we need to look into. And it also is a red flag that, for an example, for years, the CDC was just spending money researching genetics with autism when we know genetics don't change that fast. And then they were avoiding like environmental toxins and things
Yeah.
like that. So I think it's really interesting. And I know that we are definitely having some positive changes, which I think is amazing. But anyway, when we talk about aluminum. Okay, like how can aluminum negatively impact the body?
Yeah, the biggest thing is that it's a major driver of oxidative stress. And so I can get into, the accumulates in the bones, accumulates in random tissues, lungs, the brain. We know it can get into the brain in multiple different mechanisms. And when it does that, when it's there, it's driving these reactive oxygen species. And then what happens when you don't have enough antioxidants to counteract that, you're causing a chain reaction that can degrade different, DNA or proteins or lipids. If I just looked at how it can affect the myelin sheath, your nerves. So it really can impact everything, depending on where it is and what extent it's causing that oxidative damage, and your antioxidant capacity. And so you can see where if the main driver is the oxidative stress, then antioxidants, that's why, some of those may be helpful, to counteract that oxidation, but it's still there. And so that's been my frustration is, yes, we may be able to counteract the reactive oxygen species driving damage, but it's still there. I want it gone. Like I want it removed. And that's where we don't have all the answers yet, but we do have some agents that can um, remove aluminum, but they're mainly prescription. And so one is deferoxamine or DFO, and that's indicated for aluminum toxicity in dialysis patients. So it's primarily used for iron overload, but because iron and aluminum are structurally similar, then it can be used for the aluminum toxicity as well. And so they'll measure the aluminum in the blood, but that's acute toxicity. But so it doesn't show what's accumulated, in the tissues. So that can be used for someone with acute toxicity. So I know that's an option.
What is
Eating,
the name of that medication again?
yeah, DFO or deferoxamine. Yeah, and it's super expensive. I just don't see how anyone right now would get that because it's for one, it's off label and it's acute aluminum toxicity. So it's frustrating to know that there are those options, but it's not like we're going in, measuring aluminum content in the tissues for to know if it's there, to know if someone would benefit from it. And then we have EDTA has human studies for binding and removing aluminum, with one study showing that EDTA was able to reduce the aluminum burden and improve neurological symptoms. So the problem with this again is it's prescription, it's off label, it's an infusion once a week for several weeks, and the oral formulation is available, but it has poor absorption. So again, we know something that would work or works, but who's going to get IV once a week and get that approved when you can't tell the aluminum accumulation. You could measure it. If it's in the blood, then I guess you would know you can qualify for it, but you can't tell when it's accumulated. So those are options that we have human studies of. We know it binds aluminum, and so those are there. I think what's frustrating to me is then that that's not going to get applied to anyone else that may be affected, though, because one,
And
we don't know the accumulation, and two, they're not going to get approved.
yeah, yeah. And we really need, and again, well, first of all, we need to stop injecting aluminum into individuals. And
Right.
then also, we really need to research, okay, all of these people who have increased levels of heavy metals and other toxic exposures. We really need to be researching what can we do to properly help these individuals. And we need to research ways that we can see if it's possible to detoxify. But something that I think is interesting. So
Yeah.
aluminum hydroxide. So that adjuvant is actually used in rat studies. They actually use that adjuvant to induce autoimmune conditions in lab rats. And then we also see that in vaccine inserts. We always are going to see that, an adverse reaction can be immune system disorders, including things like autoimmune disorders. The
Hmm.
hepatitis B vaccine specifically, which is something that is required for healthcare professionals to receive the hepatitis B vaccine to be able to work in most clinical settings. And that vaccine is also given to infants at birth, and it has a controversial level of aluminum in it, 250 micrograms of aluminum hydroxide. And on the hepatitis B vaccine insert, in the post marketing surveillance section, it does list MS. And I know many, many, many healthcare professionals, including nurses, who have gone on to develop autoimmune conditions. And we know that there are many vaccines on the schedule that do
Hmm.
contain aluminum. And I was born in the 80s. And I remember when I was a kid, autoimmune conditions were fairly rare. I didn't know
Yep.
of anybody that had celiac or Hashimoto's disease or MS. It was just exceedingly rare. You didn't really hear about it. And now, whenever I like to call it the idiot box. Whenever the idiot box is on in my house, just about every commercial is for a medication for autoimmune disorders. And then I also think about this industry that, they have all of these lobbying measures put in place to work to mandate these products. And if these products are then causing long term health conditions, such as an autoimmune condition that may require long-term medication management, they're making a lot of money on the other side of that as well. If these are since these are liability-free products, if it's on the CDC vaccination schedule, if they do cause long-term health conditions, that
Hmm.
is that's a lot of revenue from them.
Yeah.
What is your opinion on that? I know, of course, there are good people that work for pharmaceutical companies, but we also know that at the top there have been many, many cases of pharmaceutical executives.
Yeah. Yeah, exactly. And I think that's what's tough is in our health systems and pharmacy, people I've worked with, they're all just such good people. They really care. They want to do the right thing. They're in healthcare to help people. But I think it goes beyond them and above them on who's making those decisions. And I know you're doing your job and that when you're a nurse, you're a pharmacist in the health system, you're following guidelines, you're following protocols. but someone's making those decisions. And I don't think sometimes we ask enough questions about who is making those decisions and why are those decisions being made or what's driving those decisions. And so, yes, I think that's um, definitely there's been more coming to light about that and questioning that. Um, and so hopefully that will just continue. But also with, you mentioned, just even the vaccine, there's also other medications that are just over the counter that have a ton of aluminum. These are going to be like your antacids, like Maalox, Mylanta, Gaviscon. These already, these are, you don't need a prescription. So people are not educated on the harms of them. And because you're not supposed to use them long term. And if they, and you also are supposed to be monitoring kidney function and calcium and magnesium. But I can tell you that, I mean, how many people getting over the counter medications are having that checked or even tell their physician or pharmacist that they're on those long term, So, and there's also warnings with those, or we know that long term they can cause encephalopathy, which is brain damage. That's well documented side effects from aluminum containing antacids, as well as seizures and bone weakening. So, I honestly feel like they should be banned because they deliver a high amount of aluminum without the necessary benefit when there are safer alternatives like calcium carbonate or Tums, magnesium hydroxide, or even just baking soda, dissolving a half teaspoon in 8 ounces of water or ginger, different things that you could do to have safe or better safety profiles. So,
Mhm. Well, yes, and I have found that there are many just natural things that can be done for simple things like reflex that a lot of people struggle with. And I know many
okay,
people that are on, PPIs or other reflux medications long term. And there's so many of those medications that were never intended to be taken long term. And sometimes it can
right,
be a very, very easy fix, like making sure that you are eating in a relaxed state, making sure that your body is replete in mineral and nutrient cofactors. For an example, zinc is needed to produce your stomach acid. When you don't have enough stomach acid, that can actually result in the symptoms of reflux. And I think that's one of the reasons why in functional medicine, just simple interventions, working on people's gut health, working on the gut lining, on the mucosal integrity, and then teaching them about eating real whole foods. Once we replete the body sufficiently and nutrients and work on the gut health and then work on,
yeah,
the nervous system response, we can see just such miraculous recovery. And I've seen time and time again where people, of course, under the supervision of their medical provider, once you get those people healthy enough, so many of them are able to titrate off of these medications that they've been on for years. And I also wanted to touch on, do you have any feedback or insight into natural, like, things like nutraceuticals for aluminum detoxification? I know that there are so many supplements that are on the market where the companies are promoting that it can help with heavy metal detox and whatnot.
yeah,
And again, I think that it is
yeah,
good to be critical on both sides of it and look at the evidence.
absolutely,
But I know that a lot of, for an example, I believe it is cilantro oil is something that some functional providers are using
okay,
to help support detoxification. But we know that big cilantro is not going to just come in and spend millions of dollars on a randomized controlled trial proving that it works. And then we
right,
also see things like, dandelion root, milk thistle. There's all of these herbs that we know are supportive to the liver. Do you
yeah,
think that there is, have you ever seen any, you know, sufficient evidence, even in, or even just small studies that may be
yeah.
promising on natural things for detoxification?
Yeah, so I think what you mentioned, like supporting the overall detoxification system, yes, that can be beneficial because you have to remove other toxins besides aluminum, and also heavy metals are a concern too. But as far as like the studies go, I think chlorella actually has a human study showing that patients received like nutritional algae extract for 90 days and had decreased hair aluminum levels. There's also in vitro and in vivo studies for NAC, which I'm a big fan of N-acetylcysteine because it has so much research behind it for numerous conditions and benefits outside of supporting glutathione. But it's they had a study where aluminum triggered mitochondrial dysfunction in human astrocytoma cells, and the NAC mitigated the globular shaped cells and oxidative effects in erythroid cells. I'm not saying that right, erythrocyte, but it was protected for that oxidative effect. And then NAC also has animal studies where rat cells were protected with NAC from aluminum induced toxicity. So there are studies that support NAC there. There's also animal studies for spirulina, malic acid, citric acid, but we're limited because we don't know how much it would take to bind and remove aluminum in humans with these. But theoretically, it may help, and they're pretty safe. So, but it could take larger amounts to see, those benefits, or but like I said, but to see side effects too. So they're pretty safe all options. That's not what I would like to see. Like I'd like to see more evidence and human studies to support the nutraceutical products, so that we can actually incorporate them.
Well, I love that you mentioned NAC, which for our listeners, that is N-acetylcysteine. I always have NAC in my home. And what's interesting is this is actually considered a standard antidote for Tylenol overdose, which we know that Tylenol overdose is extremely dangerous. That's another drug that I do not think that should be available over the counter. It's interesting how I don't get called anti-Tylenol, but if I talk about vax, I get called anti-vax. So anyway, with N-acetylcysteine, so it is actually a precursor to help the liver to produce glutathione, and glutathione is the master antioxidant. And we know that when an individual has an increased toxic burden, they tend to burn through their glutathione really quickly. So they may have an increased need for glutathione. And yeah, I think that NAC is extremely promising, and it is an excellent safety profile. And we've been using it for a long time, even in conventional medicine. And also I have heard about chlorella, spirulina. I also want to mention to our audience, with things like chlorella, spirulina, they're fantastic. I love it, but they also do have that ability to potentially stimulate the immune system. And then we know that we have an explosion of autoimmune disorders. So when people have autoimmune activation, there is a chance that those natural therapies could potentially, in some situations, make that worse. So again, we always want to take into consideration medical history, what medications they're on. And of course, I do want to just mention what we are talking about today. We are not advising anybody on what they should do with their medical health. So make sure that whatever information that you are receiving today, this is all education. Please do not go and do any of this without first discussing with your medical provider. And well, we have just a couple of minutes left, and I would love for you to tell our listeners where they can find you.
Yeah, absolutely. And so you can find me on Instagram at yourfunctionalpharmacist.wachal. And then my website is yourfunctionalpharmacist.com.
Okay, awesome. And so I will be posting that in the show notes. And are you working with individuals now? Are you doing consultations yet? Can you tell me a little bit about that?
And then probably the next few weeks for consults, but it's going to be
Awesome.
limited as I, get going into that. And I want to make sure I'm spending sufficient, adequate time, whereas we don't necessarily have that in conventional medicine. What we're doing, or what I'm doing anyways, it's going to take hours of research and looking at labs and putting everything together to, have an actual individualized action plan. So
Yes, and I love that. And again, with functional medicine, we know functional medicine done properly improves overall health outcomes, and it actually lowers overall healthcare cost. So, but again, it is a bit more of an investment in the beginning, but you've just got to zoom out and look at the big picture, because it does take time, researching each case and doing sufficient testing, and then doing the collaboration with the healthcare team, and then also doing all of the coaching around the lifestyle and the nutrition interventions. So, but yeah, well, I'm so excited about all of the great work that you are doing. So be sure that you check out Dr. Wachal's website, and be sure to follow her on social media. She is always just, I just think that you're posting the best content. I mean, I love what you're doing. So, well, that is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.